Estamos en el Congreso ESMO, después de la rueda de prensa, presentación de Eisai, con la profesora Lori Wirth de Harvard, de Estados Unidos. Ella ha hablado sobre el cáncer de tiroides. ¿Por qué está aumentando el cáncer de tiroides en los últimos años?
Can you give a reason why it's increasing the cancer, thyroid cancer? Why it's increasing?
So this is an interesting phenomenon. We're seeing a very dramatic rise in the incidence of thyroid cancer, and we've seen this consistently over the last couple of decades. So certainly one of the reasons for this increasing incidence is the detection of incidentally found thyroid cancers when patients are having testing for other reasons. So say, for example, a patient might have a CT scan of the chest, and in the CT scan of the chest, a very small thyroid nodule is found that then is diagnosed as thyroid cancer. So we're seeing more and more of such patients diagnosed now, and that certainly explains a large percentage of this increasing incidence of thyroid cancer. But that may not actually capture the whole phenomenon, because we're also seeing an increase in larger, more clinically significant thyroid cancers. And we're also seeing a slight uptick in the death from thyroid cancers. So it's not just these small incidental thyroid cancers that accounts for the entire phenomenon. So why are bad thyroid cancers occurring more frequently in our population? We actually, I don't think, have a good explanation for that right now. Some people have hypothesized that it may be because of radiation exposure in our modern world and in our modern lives, but we don't have any good data that has substantiated that hypothesis at this point.
Según las cifras, la mujer sufre más el cáncer tiroides. ¿Por qué causa? ¿Hay alguna causa concreta?
Why they say that the measurement of the increasing of the women having thyroid, why is more the woman than the male?
So thyroid cancer is diagnosed more commonly in women than in men. And I don't think we know the exact reason that women are diagnosed with thyroid cancer more than men. When we look at hormonal levels, for example, that doesn't seem to account for the difference in incidence between women and men. So I think that we don't understand the difference in the biology of thyroid cancer in women and men. Women do get diagnosed with thyroid cancer more frequently. One of the other things, though, is that when men are diagnosed with thyroid cancer, they actually have a worse prognosis than thyroid cancer that's diagnosed in women. So when we see thyroid cancer in men, it's particularly worrisome.
¿Qué papel tienen los biomarcadores en esta enfermedad?
What paper will have, what are the biomarks? Well, you can explain this, a biomarker. What paper has?
What paper has the
Yes.
biomarkers?
What is involved with it, for the product?
I'm sorry, I don't quite understand the question. One more time, please.
El biomarcador de biomarca,
The biomarks?
¿qué influencia
What
tiene?
function has, what influence, what function has? That's what it says.
Yes. So biomarkers are of great interest in oncology overall right now, because what we really want to do as much as we can is know which drug is best for which individual patient. We really want to personalize our approach to the individual patient in oncology as much as possible. So one way we may be able to do that overall in the field is take a look at biomarkers. And if there is a particular biomarker that predicts response in one particular patient, then that biomarker may be useful to know which drugs are best used in which particular patient.
La principal ventaja de Levantinib.
What's the principal advantage of Lunatic?
The principal advantage of lenvatinib for patients with radioiodine refractory thyroid cancer is basically that we see very high response rates with lenvatinib compared to placebo, and we see a very significant improvement in progression-free survival with lenvatinib compared to placebo. So there was a greater than 14-month improvement in progression-free survival with lenvatinib. So people are responding to the drug and responding for a long period of time.
Bueno, finalmente la ventaja, ¿qué impacto tiene en la calidad de vida el fármaco, Levantinib.
The product, pharmacy, what impact has in life, and good in the life, what impact will have?
So I think that we had a good idea of the impact on a patient's life with the discussion with Mr. Venison today. We heard from a patient today in the conference who has been on Levantinib for more than 2 years. His thyroid cancer has gotten smaller. He is now on a dose of the drug that is causing virtually no side effects. So his cancer is smaller. He's on a drug that is controlling his cancer and not impacting on his quality of life in any way, other than it's better now because the pain that he was experiencing and the bony metastasis that he has now resolved. So I think we're seeing an improvement not just in the disease, but in the lives of the people who are living with the disease.
Thank you, Dr. Lori Wirth.
Okay, you're welcome. Thank you very much.